today is going to be a part 1 of this intimacy and dating with hidradenitis suppurativa conversation with Dr. Erin Martinez and Jasmine Young and Kenneth Blue. So we appreciate your patience, and we are doing this out of love for the community. This is a collaboration between the Association of Hidradenitis Suppurativa and Inflammatory Diseases, or AHSID, and Tono Health. And we are so excited to have you. So once again, just to remind you, this is part 1, and we are going to do a part 2 that we are going to announce soon. So stay tuned. So without further ado, I want to introduce Dr. Erin Martinez, Jasmine Young, and Kenneth Blue. Thank you so much for joining us today.
Hello.
Hi. Dr. Martinez, I think your mic is muted.
Good Lord. I'm here.
So I'll let you all start the session. Thank you so much. Stay tuned, everyone. Bye.
And again, just to echo what Jasmine said with a beautiful amount of energy, is thank you so much for your patience tonight. I know it can be really frustrating to wait in that waiting room and wonder, do they see me? What the heck is going on? So we appreciate it. We are going to do a little bit of introductions and then move into some concepts tonight. So Jasmine and Kenneth, can I pass to you for some introductions?
Sure enough. My name's Jasmine Young. You guys may know me as that HS chick from TikTok. This is my fiance, Kenneth Blue. Both influencers, both here for the community, and we're excited for today. Like, I'm so excited.
Thank you. And I also share that excitement. My name is Erin Martinez, and I am a certified sex therapist and sex educator, and have worked quite a bit with the HS community over the last decade. This is my first opportunity to actually work in a live demo. And one of the reasons we thought that this would be really, really beneficial is so that we could learn together. And instead of me just presenting concepts that you can maybe take home and try out or think about, we actually have the real feedback of this beautiful couple here with us that are brave and willing to try out an activity I've put together for this evening. And I think what we'll do, since time and tech was a little quirky with us, was we will, I'll introduce the concept and we'll talk a little bit about goal setting for it, which is something that you would be doing at home too if you were doing this with a partner. And then in our next session, which is going to be coming up really soon, as Jasmine said, we'll actually get into the doing. So we're going to do the prep work of our exercise and then the doing and processing in our next session. So I think that if you were watching tonight, you have some excitement about some of the ideas that we are showing you. You will be able to apply concepts 1 if you are thinking about doing this with a partner. You will also be able to take these reflective activities in your own work as well. So if you're not somebody that's currently dating or partnered, this is still useful to you. So could I have the next slide, please? Thank you. We did the introductions. Okay, cautions and consent. So what I do want to caution us about is that we are not doing therapy live today. And so what we're doing is we're doing an activity, an exercise, and this is something that you may want to take pieces of and try in your own time. I do also want to caution people that anytime that we're intentionally diving deep, that we're doing any work that's somatic or cognitive, and we're involving the issue of intimacy, that can be super vulnerable and it can awaken things that we don't intend to. So please know that it is very important to think about taking care of yourself in this work. And you'll see some ways about being very intentional about your intent in this particular mindfulness exercise. So again, this is serving the purpose of education, not of therapy. If you do have questions about the activity itself, I will ask maybe some of our good people in the background here from Tono to share my email in the chat or the Q&A, whichever is easier. And I'm happy to answer questions about the activities that we talk about today. Okay, thank you. Next slide. So I named this activity Focus Touch, and it pulls from some other sex therapy activities that have existed for a long time that you use more touch in the form of mindfulness. And what I've tried to do is bring some flexibility to this activity. And I think that's especially useful for many, many groups, but those in the HS community often feel very limited when they think about parts of their body that they maybe they're having pain in, or they feel discomfort in, or they don't feel a sense of confidence. And so what we're using here is an exercise to expand our vision of intimacy throughout our body. And we're also opening up information to our partners so that they can learn about that. So I'm not limiting this activity to mindfulness. I think we can also make it a sensual activity. We could also make it more about connection and trust building. We could make it about something erotic, right? There's a lot of flexibility about this activity. So I'm going to ask Jasmine and Kenneth, if you could tell me a little bit about the space you're sitting in, if you could kind of describe it from a sensory experience. So what do you have going on in terms of like comfort, lighting, smell, and what are the distractions in the room as well?
Ooh. So we're in our living room / art studio right now. So the distractions are of many. There's art stuff everywhere. Our couch is comfortable. It's microfiber, like the soft, squishy couch. That's how I describe it. It's a soft, squishy couch.
A lot of vibrant colors.
Okay.
Between the paintings that we have on the wall, our color selection that we use for the coasters that we make, it's pretty vibrant.
Okay.
Yeah.
And you both are artists?
Yes.
Okay. So this is a space that actually like brings life to you, I'm assuming.
Oh yeah. A
Okay.
lot. We've created hundreds in here.
Okay. Beautiful. What about I know obviously it's not ideal because you have the light from the computer screen, but in terms of the lighting of the room, does it feel would you say like calming or exciting, or how would you describe your lighting?
I would say it's pretty calm. We're reaching what I call the golden hour because the sun is setting and our living room faces towards the west. So there's like this golden hue coming into the art area from the window. So to me, it's calm. Like if I were to turn off all the lights in here, it'd just be one golden area.
Ah, I love that. Okay. Okay. So as you're listening, you're hearing, and please know I did not even prep, like implant these answers, but like you can hear how the space sounds positive to them. And this is a really important piece that we often don't take the time to do in any active intimacy enough time, but also like it doesn't, when we center ourselves in thinking about it, it can be really beautiful because we think, oh, this is a place I both feel calm, but maybe also safe. This would also be an opportunity for in real time. Let's imagine we're not watching Jasmine and Kenneth and they're being able to enjoy this on their own. This would be an opportunity for them to say like, hey, I think I need a little bit more room to start out with, or I'd feel a lot better if we were a bit closer. They'd also want to be thoughtful about temperature. So you're also seeing in the second part, the second line here, there's this information about clothing. Now, this is probably going to be posted different places. So we wanted to start kind of simple. But if you are using this activity on your own, I think it's always good to start. My recommendation would be to start with some level of clothing, because this will awaken emotions in you that you maybe are not always intending to awake. And it's very, very vulnerable. So ideally, if you can start with a little bit more clothing, and you can always have a second session or remove some as you go. But that would be my thought. And it can be done with all clothes, or it can be done totally naked. The other choice you're making here is this idea of who's going to be the toucher or the touched. So I'm wondering, what I want to ask you, Kenneth and Jasmine, is what are the concerns or thoughts or emotions that come up with either the idea of being touched or the toucher?
I don't like being touched. I'm just being so honest. Like, that is probably the biggest thing. He's the toucher. I'm like, hey, over there. Unless I'm like in a really awkward situation, and then I like curl into him like a snail. But other than that, he's the toucher.
Yeah.
Okay.
Yeah. In other words, her desire to be touched can be based on her mood at times, but overall she's kind of like okay, a little bit standoffish, which is okay. I get it. So I've learned to adapt.
Okay. Kenneth, can I ask you, like, in terms of the responsibility of that, like the responsibility of trying to figure out where Jasmine's at and what the mood is, does that feel like a big job for you?
Overall, no, but it can be at times, because sometimes I can just look at her and just know that, okay, either she needs to be consoled, or sometimes I feel like I can look at her and, depending on her mood, I may need to shy away, Sometimes I just need to be an open ear versus, okay, come here, give me a hug, it's going to be okay, So it varies. It varies. It's not really a heavy or taxing concept, but, it varies, like I said.
Yeah. I really like one of the things, and I'm trying to remind myself to stay in my educator and not therapist role, but one of the things I really enjoy about what you're saying is that you're able to say that this is my partner's feelings, right? And it's not a response to me. It's not about me. And I think that that's a really, that's a hard place for some people to be in, but it's really, really useful that you're able to do that. And so you can also hear in the audience that we could play with this dynamic quite a bit, right? If we decided to say, you know what, Jasmine, why don't you take the job of beginning as the toucher and you see what you can learn about Kenneth, that would be a different type of challenge. We might also say, Kenneth, since you're usually the person trying this out, let's start with you. And what we're going to do that's going to be also challenging probably for Jasmine is that we're not going to use verbal cues in this exercise. So, so Jasmine is going to have to lean in a little to discovering new experiences about touch, and also using touch her own to do what we call hand gliding. So if you imagine that this is Jasmine's hand here, sorry, if this is Kenneth's hand and you're the toucher, Jasmine's hand's going to go on top of that and literally glide the direction, right? So that says, if I'm gliding somebody and I say, ooh, I notice that when the top or the back of my neck, let's say the back of my neck is touched, it kind of gives me a little bit of the chills. What I want to be thoughtful about, if I'm the one receiving touch, is how am I trying to grow in this opportunity? So do I want to challenge myself and say, you know what, this is kind of an uncomfortable place, but I want to see what it would be like just to leave your hand here for a minute? Or do I want to see, I want to give a message of maybe more pressure or gently rubbing or maybe even a pinch, right? We can do a lot about awakening different sorts of feelings with that touch. So I think there's different ways to challenge in this idea. We always want to be mindful of consent. And since we're trying not to use our words, and what's the reason for that? There is a reason for that. We're trying to stay more within the body. So if we are using our words, it puts us more into a cognitive space, and it kind of gets us off base a little bit. So if we stay in a nonverbal space and we use our bodies, it can keep us more tuned into those feelings. We can also be prepared, and this is something to think about in stage 2, of bringing sensory tools that you might want to use. So what are ideas? We want to think about things like texture, so things that are soft, things that are rough. We can also play with things like temperature. So ice cubes. I often have like a one of those heated pillows that I can try. You can also think about involving smell if you want to. What I want to think about, and this might take a moment or two for you, Jasmine and Kenneth, to consider, but I want you to think about, where is your area of growth that you want to tap into? Is this more about building trust? Is this more about exploration and learning about something new? Is this more about connection and healing? Or is this more about the sensual or the erotic?
All of the above.
That's a good answer. Yeah, I would have to say all of the above as well. Yeah. Yeah.
Okay. Something to think of within yourself, and this might not be something that you feel open or ready to share, but again, we're kind of giving these tools to the audience too, so they have their own prep work here. I want you to think about and stay centered in what parts of your body are you trying to highlight. So do you want to lean into more of an area of confidence that you can learn about how to increase feelings of sensuality or the erotic and invite your partner into that? Or do you want to start with an area that is very, very vulnerable, that maybe holds something that you kind of hide away from? You can use this activity to direct attention there. And that's just something to kind of toy around with and play with on your own. I want to pause for a minute here, and off screen, Jasmine, do we have any questions that the audience has just as of yet about the prep work on this?
No questions have come in so far, but if you all do have questions, there's a Q&A function and there's a chat function. So feel free to chat amongst yourselves and also ask us questions.
Thank you. Okay. And if we could flip to the next screen, thank you. So we talked a little bit about this idea of hand gliding. And that is, you would do this even if you choose to use words. I'm going to, well, so I described that a little. It's kind of your hand on top of the person. So the person has their hand on your body and you're going to sort of drive their hand around. You're thinking about, if you're trying this at home, you want to be thoughtful of the level of clothing you have and the area of the body that you might want to focus on first. And then staying open. Now, Kenneth and Jasmine are bringing to this wild sense of openness, which is beautiful. But they're saying kind of like all of the above. I want to see what will happen. And there is nothing wrong with that. But if you also feel like for you taking this activity, you want to be a little bit more intentional in some way, that can be really useful. So I sometimes use this activity for individuals who are getting to know each other or maybe healing. I've worked with people that there has been cancer, body trauma, sexual trauma, affairs, and there may be the experience of increasing trust, of inviting somebody's touch back into your life and being able to heal through that. And that's in a, you know, would that be spiritual? Certainly. Would it also be healing and exploration? Yes, but be thoughtful about that. As the toucher, you are really taking this opportunity to listen and learn from your partner. So you're not driving the decision making, you're learning from them. And you're learning through what you sense from yourself. And it is not wrong if you feel very excited about this. It's not wrong if you feel really nervous about it. Those are things just to kind of clue into and be aware of. And again, you are listening for their cues of like, I like this, maybe press harder or rub gently. And then you're also being directed to where you want to pace or move on in the body part. So let's just take a little bit of an example right now, okay? And I'm going to ask if it's comfortable, can we have you kind of receive the touch for a minute?
Sure.
Okay. And Jasmine, if I can ask you to kind of begin at the back of Kenneth's head. Okay.
For the neck or just the back?
Yeah, kind of like the neck. Okay. And so are you able to comfortably put your hand over hers, Kenneth, or is that too hard?
Okay.
You can. Okay. So I'd like you both, if you can, to close your eyes. So you're relying just on the movement. And I want you to see if you can use either pressure or the movement of Jasmine's hand to either try out something that you like or to let her sort of touch you in a way that feels good to you. And then I want you to try something that maybe feels new to you. So maybe that's some nails, maybe curl her fingers under, maybe that's spreading her fingers open a little bit more, maybe that's pushing them down a little bit more. Great.
I think you're supposed to be moving my hand, not me moving your hand.
Look, I was enjoying it.
And we see also Jasmine breaking the rules right here and talking very Okay, so let's pause, open your eyes. Okay, and we're just going to switch gears a little, okay? So I want you to put your hand on, Kenneth, if you can put your hand on Jasmine's arm, whichever part of her arm you want to. And take your other hand and guide his, Jasmine. So put your hand out. Yep, perfect. And I want you to try in the same way. Close your eyes. Let yourself just kind of lean into that. And then I want you to use the movement, the pressure, the speed. That's really good. Okay. Come back, open your eyes. This is just a little trickle, okay? We're just doing a little bit here. Tell me what was hard about it.
Not talking. I will say that was probably the hardest thing because I really wanted to tell him to squeeze harder, but I couldn't
Okay.
tell him, so I just kind of like squeezed my hand to his hand. But that was
Yeah.
probably the hardest part, was not talking.
Okay.
My arm is probably my favorite thing to be rubbed on, like,
Oh.
so it works.
Okay. And so, Jasmine, do you always know that you want more pressure, or was that something that you was different, or that's like usually where you go, more pressure?
I usually go for more pressure, but I don't tell him. Um, Normally, I'm a little excessive, and I'll just like plop my face into his hands or something like that,
Okay.
to relieve the pressure that I have building. But like, I want his pressure too. I don't know if that makes sense.
Yeah. Yeah. That makes great sense. Okay. Thank you so much for sharing that. Kenneth, what was it like for you? What was hard about it?
I won't say it was hard because it's something that I already do normally. Like it's a normal, I guess, action for me. I guess there was a difference when it came to the pressure because, of course, she doesn't really tell me about that part, and I don't really apply pressure much. But I don't have a problem with it.
Well, I'm pretty excited that in our first 3 minutes, we already learned something new.
Yeah. We did.
That's pretty awesome. And remember, like, we're starting very slow just in I'm thinking about this. One, we're not asking people that are kind enough to volunteer to go full on in, right? Like, we're not trying to have complete nudity here on our tonal health screen. We're not doing that. But in the same way, I think it gives you a little bit of an idea here how this obviously you are a couple that knows each other very, very well. But this is a very different activity where you're being very, very intentional and you're learning something new. As you take off layers, as you focus on parts of your body that you might feel more vulnerable about or have history of being touched in ways that maybe you didn't like. This can be very, very, very emotional. And that's why we want to start out slow and very thoughtful about how we're walking into this. Could we have the next slide, please? So where can you take this? So the elements you're always thinking about are communication. So we're stopping and we're pausing quite a bit. If I was helping to direct this and we weren't with a live audience or we weren't recording this, we would keep quiet for probably up to 25 minutes. We would have already named the body parts we're going to focus on. And so maybe we would say, Kenneth and Jasmine agreed on waist up. And they're going to kind of like, do we want to start on the front or the back? And they would also have a safe word or a safe gesture. So a safe gesture would also be if you're trying to stay with the idea of the nonverbal. I see we do have a question, but it popped up and then it went away. How can a partner help their HS partner find more confidence with self? How can they help their partner to see and appreciate the same beauty that they see, sensual, erotic, etc.? So really beautiful question. I love this. So I think if I can, there's a little bit of this dynamic that we heard with our guest couple already, where Kenneth, you kind of show up and you're just like, I'm the toucher. Like, I love this. So there's a sense of like, I want to be in this. And so part of what works about this activity that helps the other person that may not feel that confidence is they are the focus, but they also have some level of control in guiding that focus. And that matters. That matters when you have a sense of your body that you don't feel comfortable with. You might not be ready to full on focus on that. So that might even be, you know, some couples will do this thing where they remove some of the fingers and they just take one finger and they hang gliding. And it's just like, I just want you to poke me right here. And that's all that I'm able to share right now, right? Or even just the activity of lying quietly and silently and being seen can be very, very healing. So those are a couple of the ideas, Paul, like for your question of allowing some permission for the person that is the toucher to enter into that, but also leaving some control for the person being touched. My advice is if you are in a partnership where one person is not having as much confidence with their body and the other, that person may want to be the touched first. So, and the person that's feeling a little bit more confidence might be the toucher. What did I do here? Jasmine, can you help me out? Because I feel like I might have missed a question.
Yeah, absolutely. So there's another question. What if you are a partner touching an area that has active flares or painfully tender because of flares? How can you alert them without spoiling the mood?
Oh, that's a beautiful question as well. I would think about a couple of things. Again, I would have a gesture that is sort of like your safe word, but your safe gesture. And that might even be something that you do with a free hand, or it might be something you do with like maybe with your leg, for instance. I would also, you know, I would use the no and, but in a nonverbal way. And so the no and is, I don't want to do that. No, thank you. And I would love to do this. Right. So what hurts us in intimacy is when it's just a full on no, just don't. And there's usually some form of an and, right? No, I don't want to have sex, and I'd love to sit next to you and cuddle. That's a no and. A nonverbal no and in this activity might be if there is pain in that part of the area, I maybe shift around to somewhere nearby and I just hold the hand nearby, which is to say, like, I'm not terrified of you being anywhere here, but it feels better to my body to be here. Nearby, but not on this part of my body. You can also use signals with your clothing. And I think this can be, especially if you were going to more of the sensual or the erotic, to take maybe colors or fabric that you feel is lends itself to something that you feel like is pretty or beautiful. And you can kind of cover the areas that you don't want to focus on, and then you're leaving some other areas naked, right? So can you imagine how that might be exciting if I don't want this to be on display, but this part of me I do? That's a little bit different than no, don't see me. This is no, don't see this, and see this. So that's another exciting way to play with it as well. The other piece that we're going to be talking about in our next session is the processing. And that's also the part where You heard from just our little snippet how Jasmine and Kenneth had these like, oh, well, I didn't know you needed that. And wait, hang on, you're not doing. So that's a moment to kind of pull it together and to ask questions about each other and to share what was being experienced as well.
Absolutely. And we have, I think this is more of a comment, if it's okay to read that.
Yeah.
Okay. So Fat Girl AIP said in response to the previous question, one thing that helps them is having their partner being very vocal during intimate activities. So they tell them what they see and how much they like it. They tell them how good it feels. This also helps them to stay present and to not let themselves get in their head about their scars and other things that are going on with their physical HS symptoms. They also say, I give them the roadmap at the beginning of tender areas that are off limits for that particular day. And that usually works pretty great.
That's beautiful advice. I was thinking about like kind of channeling what this audience member is talking about. I often have talked about the body mapping, and that can be a preface to this activity if you want. I might just kind of bring that to our next session, just so I think a lot of people might be familiar with it, but I think it's a lovely way to also say, here's my kind of red light, green light, yellow light areas. And that can be a roadmap to exploration, and you can still be playing with the different types of touch once you get into this activity as well. Are there any other questions, Jasmine?
There aren't any other questions, but I do want to ask Jasmine and Kenneth, do you have any reflections after what you just experienced in this part one? Is there anything that you all would like to share from your experience that has helped you in your intimacy, to strengthen your intimacy, especially as individuals with HS?
Excuse me, be as open as possible with your partner. He kind of got a crash course when we first got together. Literally the first week my son was in the hospital, and then not even a month later I was having surgery. So it was like full-fledged, we're in it crash course. Be one with your partner. Like, talk. As much as this exercise didn't allow us to talk, when he was changing my bandaging for the first, am I in here?
Yeah.
You're here.
Okay. When he was changing my bandaging for the first time for our first surgery, the look on his face, like I had to register, although I'm in pain, I'm the one that's kind of out of it, he's still affected by this. So giving him reassurance along with him giving me reassurance, and then allowing him that space to process and deal, like, it's a lot. We've lived with it our whole life. Our partners have not. So they need time to process, to heal, to understand what's going on. I may have talked too much. You?
No, I'd say you'd hit that one on the head. I've also come to learn that, when it comes to me being the affectionate type, and then sometimes she may be in a flaring type, or in a flaring, her body may be flaring, and she may not need the affection so much. I've learned to not see that her saying no, or her, shying away as a form of rejection. Because, of course, with me being the type of person I was, it's like, okay, you say no, instant rejection, I'm in my feelings now. And rightfully so. It's not really about that. It's about, okay, she's having to deal with her own body. She's having to cope with her own body. Not to mention, it wasn't really about me per se. Even though I knew what I wanted, and I knew that to some degree she needed me. However, in that moment in time, what she needed was space and or time, or even just, I guess, a moment to deal with whatever she was dealing with, whether it be a flare or a potential flare, or a flare that already ruptured, whatever the case may be, It wasn't really just about me and what I wanted. It was about, okay, let her do her, and then we'll come together as it needs to.
Yeah.
I love that. I absolutely love that. I wanted to ask you, Kenneth, like, after you said that, I was curious about, or both of you actually, what is the process of like seeing HS scars and then being intimate with each other? Because for some people, some people can be quote unquote squeamish, or when they see open wounds and scarring, it can be sort of like, I don't want to say a turn off, but it could be a sort of like a barrier to intimacy. So how do you all deal with those if they do come up in your relationship?
Ooh, that's a good question. So I didn't want to show him. Like when I had surgery, I told him, I was like, if you don't want to be there, you don't have to be there. I'm okay. I'm a big girl. I've been doing this myself for a long time. He's like, no. I'm like, you don't have to. It's a lot. But he went full fledged in, and I'll let you finish answering that question.
Okay. Well, for me personally, I'm not the squeamish type. Blood, gore, and whatnot. I've been exposed to. But as she said, when it came to me seeing her after a surgery, after the incisions, it's like it affected me because it's like I've seen things on other people, people that I wasn't necessarily in a relationship with. And then I'm with her and I see it on a daily, and then, okay, come home, it's like, this is my person. So it's like, cuss word. So I guess it was just it was the same, but it was a new dynamic to the same situation or to a similar scenario, and rightfully so. I just had to, suck it up and deal with it, because rightfully so, this is my person. She's gonna need me to be there, even if I'm not physically there to sew her up or patch her up or clean her up. That moral support is always going to go further than the physical.
Absolutely. And I love that you all were so honest and vulnerable. Thank you so much for being a part of this part one. I'm really excited to continue this conversation for part two. And I thank you all for entering in all your questions, talking amongst yourselves, giving us so much love and reactions. Thank you, Dr. Martinez, for coming here to lead this session. I'm very, very excited for part two. We will make an announcement soon. Thank you all so much, because this recording will be available soon as well, and you'll get information about that. And we will see you next time, hopefully for part two of intimacy in dating with hidradenitis suppurativa. We'll see you later, everyone.
So grateful. Thank you.
Bye.
Bye.